So again, traditionally, it's important to be diagnosed with a concussion. So there are testing now. Coaches are being taught how to assess if a player has had a concussion. A lot of schools are doing preseason testing, preseason baseline CAT scans or MRIs, so that if a student, whether college, high school age, this is usually occurring, if they have a concussion, they can't return until they're back to the way they were pre-concussion, right? Which is good, because before the players wanted to go back into the game, the coaches wanted the player because this was their best player, they were going to lose the state championship, and they were re-injuring themselves. And one of the worst things is the re-injuries. It compounds it. So it is identified that someone has had a concussion, and basically what they say is rest. Now, when you think of rest, obviously people think of go home, sit on the couch, and you get these teenagers and they go and sit and watch TV, or they start texting, or they're on the computer. It's resting the brain. It's not allowing them to text, use the computers, anything. It's resting the functions of the brain. So that's really, really, really important. It's not the body physically at rest, it's the brain as well as the body. It's avoiding impact. So for example, my husband is a big bike rider. He couldn't go back to bike riding. We waited for like 6 weeks. He couldn't do the elliptical because that up-down was jarring to his brain. Driving to his doctor in Boston, the road gave him a headache and made him spacey. So you have to think of these everyday activities not jarring the head because it's inflamed. There's bleeds, there's at the very least inflammation, and you've got to promote healing. If you have an athlete, again, after the period of rest, the second stage is introducing an activity again. So if you had a football player, they might be doing some running on their own, gently, slowly, not with a team, non-contact. Then they do, again, some sprints, but no contact. They talk about having the player have a jersey that's different than all the other players to identify them to avoid contact. And then the fourth stage is incorporating them back into the contact sport again.